know that 1 in 7 people each year will actually have a diagnosable mental disorder. But counselling is not just for people who are unwell. Counselling can be incredibly transformational for people who are functioning pretty well and want to work through something from the past, want to increase their functioning in some way. So a big question, and something that I think is really important, is does counselling or therapy work? In most studies for the past 30 years, the average treated person is better off than 80% of those that did not benefit from treatment. So what this means is, if you're sitting on a therapist's couch, you are probably better off than 80% of the people with the same problem that don't seek treatment. That sounds pretty good, and it really is. It's actually an equal effect size to coronary artery bypass surgery. It's 4 times as effective as having fluoride in water. It's 27 times more effective than having aspirin as a preventative for heart attack and stroke. It works. You know, when I see these stats, I think, man, they should put psychologists in the water supply. Seriously, every time you turn on the water, someone pops their head out and goes, "Hey, Tony, you alright?" It really, really works. It's also really cost effective. Counselling is really cost effective in that we know when we compare it to other treatments. In the short term, taking something like antidepressants is cheaper. But the problem with antidepressants is that once you come off them, the effect goes away. Whereas the difference with counselling is that if you have, say, 10 sessions, what the research shows is that you get the benefits after 10 sessions, but then you continue to improve after you end therapy. So this means you're still able to use the skills, the lessons learned after therapy stops, and you can use these for a lifetime. In a major research study from Headspace, they found that after 3 months follow-up, people who had received counselling were still improving at that point. And the longer you were in counselling, the more you improved after counselling ended, because the more skills you had, the larger the repertoire of coping mechanisms you were able to have. So counselling works. It's really effective. It's as effective as surgery in many cases. It's cost effective, and it doesn't have that many side effects. There is such thing as a really, really good therapist, or a super therapist, or super shrink, as they're sometimes called. A study that I like, published in 1974, followed adults who had been treated as children in the New York mental health system. Ricks found that major differences in outcomes were dependent on who their therapist was. So some of these kids grew up, went to jail, some of them led happy, productive lives. And he was able to trace back and say, gee, people who saw this therapist, on average, didn't go nearly as well as people that saw this other one. So who the therapist is makes a massive difference. It is not the theories and techniques that heal the suffering client, but the human dimension of therapy and the meeting that occurs between the therapist and the client as they work together. Psychotherapy is a process between 2 people, both of whom are bound to change. Counselling is based on a collaboration. It's based on a repertoire of skills. It's a process over time. You use yourself as the tool. It's creative. You've got to think on your feet. You can't know everything that every problem that a patient's going to have. It's an art and not a science. So what does a therapist bring to session? I bring skills that I've learned. But the most important thing I bring is compassion, being caring, honesty, realness, sensitivity. We know from the research that effective counsellors become deeply involved in their work and derive meaning from it. And might I say that counselling is an incredibly meaningful pursuit. One of the first things you do in therapy is you'd ask a patient, what are your goals for coming here? Why do you want to come here? And I spend a lot of time on this in my first session with people. I write the goals down and I say, let's say you would come here for 10 sessions and you would think, yep, this time's been really time well spent and I've gained a lot. What would we achieve? And then it's up to that person to come up with what their goals are. But sometimes patients come without a sense of what their goals are. They don't know what they want. And so it can be a collaborative process to work that out.